Welcome to the Talking Turning 65 live stream, where you look forward to being 65, or you wish you were still 65 and want to make the right decisions for your retirement years. Grab a pencil and notepad and join us to find out ideas to build security in your healthcare, wealth care, and estate care. And now is a good time to tell a friend we are live. And now, here is your host, Mark Rogers.
Hello, everybody. Mark Rogers here of Talking Turning 65. And we are on our maiden voyage here of getting up and going. I think it's going to be kind of fun because there's a lot of people that are looking for turning 65 stuff. That could be Medicare stuff. It could be other healthcare stuff as well. But I'm excited to have with me also a compatriot I've known for 20 years. And I need some applause to bring her to the stage here. Let's bring her to the... How about that, Leith? A little applause to bring you on.
Yeah.
Good Monday morning. Good Monday morning. How are you doing?
I'm doing good.
Good. Well, I'm looking forward to this because of the fact that, you know, we've been talking about this for some time to do some kind of Monday morning show. And as we go into the end of 2025 here, being able to talk about Medicare stuff, you and I both in the business for 20 years. We've been helping people all this time. And it's all about what I'm finding, Leith, is as we go on, people are going to find less and less human resources to work with. The TV ads are going to be there. There's things behind the scenes that are really starting to say you got to have a personal relationship. So we would like to throw some tips out there as we go along here. And I think that's what you like to do too. I think we're both of the same mantra. We like to serve, right?
Yes. I think it's just really important. I think it's people are bombarded with so much mail and advertisements on TV, and they don't know where to turn, and they have a question, they can't find their book, and it's just nice to be able to help people maneuver through all of those issues that come up every year.
I know, and I get the calls. I start getting the calls, and just to make sure that everybody knows is we don't right now. We are ahead of, we're a couple days from October 1. October 1 is when things are going to fully roll out for people. And so right now we're just getting going just because we believe there's a few changes we do know about. And so we wanted to share that first and foremost, and just talk about what we have up ahead of us here too, because we hope to go live every Monday morning, taking your comments and questions as they may come up. Make sure and drop the comments, questions down below. I also share some information how to get a hold of us. But let's first jump to the aspect here, Leith, of a news item that I just saw come across here. And I think it's important to see that CNBC says Medicare Advantage enrollment expected to fall in 2026 as insurers cut back on unprofitable plans. The Centers for Medicare and Medicaid Services, this is dated September 29th, actually today, published today. They see that the enrollment from MAPD plans are going to fall from 30 to 34 million, down from 35 million. So 1 million people are going to disenroll or something from Medicare Advantage plans along the way. I think it's very important to see this, and I also want to highlight. Can you see that highlight, Leith, I'm doing on the screen there? Do you see that?
Yeah, I can enlarge it here.
All right. Insurers have cut broker commissions on 15 to 20% of plans to discourage enrollment in unprofitable plans, according to data. And so I just wanted to share this idea that, we actually, we are finding out that as time goes on, there's certain things in the marketplace. They're cutting commissions on various plans, and in doing so, when they're cutting commissions like that, that's going to start to really make the choices different. Either you're going to be calling 1-800 on the TV, or you may be talking to an agent advisor, and in doing so, the agent advisor is only going to be speaking to things that they're going to get paid for. That's a big deal. But the other thing that article is mentioning too is the federal government and whatnot is cutting reimbursements and things to the insurance companies for these Medicare Advantage plans. So this is a big thing as we go through here. People that have MAPD plans, 1 million, according to that article there, 1 million people are going to disenroll from the MAPD stuff. So that's going to be kind of interesting. Of course, Leith,
It'll be interesting to know what the reasons are.
Right.
Is it just that the plans are going out of the area because they can't enroll because there is no plan to enroll in, or what are the reasons that why they expect that many people? I think that was the first thing I thought of. Was like, how come that many people they expect to disenroll?
That's
Makes a
right.
difference. Yeah,
that's right. And I like what you're saying there, Leith, because there's, as you said, there's multiple reasons. Like you and I both know of a particular city in Central Oregon that. Here, I think we're on 24 months ago now, where MAPD plans had them all sign up, and the one hospital in that city would not take a major Medicare Advantage plan, and that left there's nothing they could do about it. Nothing they could do.
There was a couple. There was one in rural, and there was one in Central Valley. That same thing, and it was a nightmare for people. A nightmare.
Right.
So,
So that's the catch on the Medicare Advantage plans, right? Is every year you have to sit there and make a choice, and you're at the behest of the federal government and how they're insuring, how they're building, they're paying off, they're reimbursing the insurance companies, and the insurance companies what they're doing for the networks that are out there as well. So something interesting to watch as we move forward. So. Anyway, so that is what I had. One little Medicare news I wanted to pop up there. What else did we have, Leith? Did we have the Medicare New book that we wanted to?
Yes, the new Medicare New. If you are currently on Medicare, you're going to get one of these in the mail, right? Right. So, I know it's big. There's a lot of it to go through. It's it's like where do I find anything? But I think on the first page.
Okay.
And actually on page, I just had it up here. I think it's page 81. There will be an increase in Medicare Part D deductible. Goes up to $2,100.
Should I go up to 8?
Sorry, not deductible. I'm sorry. I'm sorry.
Yeah, goes up. What page, Leith? 81?
I'd have to look. I'm sorry.
Okay. Here's page 79. So folks, if you have your Medicare and U book, page 79 is where you're going to want to turn, because I've already got questions coming in the office right now with regards to Part D. And again, we're not going to see this. These changes until basically. And I'm going to throw this up. I'm going to throw this really quickly up on the deck here too. I encourage everybody to. Boy, this is good. Medicare.gov. Okay. And I want to make sure that everybody, I can't say enough about how key this is to have Medicare.gov, making sure you have Medicare.gov on speed dial. It is a good site. I will say it's a good site. And so what Leith and I are looking on the screen here is the Medicare and U book. However, Medicare.gov will show the Part D plans here that are coming up here, the new plans for 2026.
Right.
What did you have here on this page here? Did you have, was there something we should be looking at here?
Well, the Part D, the cap is, I think, $2,100 this year.
Okay.
That was really about the only thing I saw so far.
Okay.
But again, if you go through, and then if you notice in the Medicare and U book, they have these little symbols. So if you go to back to that page you were just on, Mark.
79?
No, the next one.
Oh.
Go the other way. Next one.
Here's this page, page 81.
Stop right there.
Yeah.
See where it says new on the left-hand side?
Yeah.
Those little symbols, a lot of people just, how you're reading something, you just don't see that. If you're looking for the new things that are coming up in the book, look for those little symbols where it says new.
Right.
And that's really good. The other thing I found I thought was really interesting is Mark was talking about the Medicare.gov site. They also have a section, if you go to Medicare.gov, and it's on page 31 of, excuse me, I'm getting my page mixed up here. It's on page,
You're in the book?
Yeah, I'm in the book.
Okay.
31. It's on page 31 about
All right.
about advanced primary care management. So they've made changes to that. So
okay, let's pop over here. Pop over here to 31. Come on.
31.
There it is. There's 31.
See down
right
at the bottom?
Yeah, I see
where
that.
it says new.
Yeah.
So those are, those are things that, you just may browse through your book, but look for the new things because they're really important.
That's great.
Really important things.
Great. Yeah. Well, Leith, tell me, and of course, I'm not Medicare age. You are, and you wouldn't know it. Everybody, you wouldn't know it. Leith is Medicare.
Thanks, Mark. Thanks.
But when did you get your book?
I got my book just this last week. It's been within, maybe 2 weeks ago. I've had it.
Okay.
And it's just I was really surprised. I think this year they've done some changes to the book that are just enhanced. The language is a little more clear to read. When they talk about the new things, it's better explanation. They're putting the website in, so if you're at a section and you want more information on it, or if they have advanced website information, they put the site in there, so you don't have to think, oh gosh, what's the site? Where do I go? Where do I find it? So that's a really good thing. On page, can you go to page 47 real quick, and then I'll.
Yeah.
I don't want to get too off track on too much stuff.
Yeah. No, let's do one more. What page? What?
Page 47.
47, all the way down to 47. It's a lot of pages, folks. There it is, page 47.
There it is.
Yes. Yep.
Okay. See at the bottom it says Medicare.gov procedure price lookup.
Yes.
So you can go in there. I've already done this. You can go in there. You can put in your procedure. You can find how much it's going to cost. I mean, and if Medicare covers it. I mean, it's a great tool. It's a great tool.
Let's see how we can do this. I want to play that out. So so walk me through that procedure. Okay, one moment. Okay. Let me bring this up here, and let's do Medicare. This is Medicare.gov
/
Okay, /
procedure dash price dash lookup.
Okay. Now, is that sharing on your screen or no?
It's on mine, yeah.
It is? Okay, yeah, it's there. All right, so here you go. And watch this. I'm going to go ahead and one moment here. We're trying to make things easy for everybody here. So I'm going to throw this in here like this. And there we go. Okay, so this is where we are. Procedure.price.lookup. All right. So that's cool, Leith. I think, look at that.
Yeah.
Planning outpatient procedure.
Right.
You know what's good about this, Leith, is as we know, or many don't know that a lot of expense is in outpatient procedures, right?
Right.
Okay, folks, here's the deal. Medicare on an outpatient basis is going to pay 80%, which is going to leave you on the hook for 20%. Mm-hmm. So having
original Medicare.
Yes, that's right. And so that's what's important about this is you'll see how much the patient pays with original Medicare and no supplement Medigap policy. Man, I'd have everybody just highlight or bookmark that because you plug in your zip code and it's going to tell you for a hip surgery or a knee surgery, 97801. Let's just throw one in here. Let's throw in a zip code. Let's just play with this for a second here. How do we do this here? And let's see here. It says, so you got to...
So you need the procedure name or code.
Oh,
it's
okay.
not zip code. So
okay. Hip. Let's do a hip surgery.
Yeah.
Let's. I don't.
Yeah.
I don't even spell it right.
Just do hip replacement.
Okay.
Just do hip replacement.
Okay. Let's just play with this here, and it's not allowing me to. It's not allowing me to search by procedure name. Type of procedure. All right. Hit return. Here we go.
There it is. select one or two.
Oh, let's do the first one. That's cool.
Yeah.
All right. That is way cool. So let's buzz to the top here. Anthroplasty, azeptibular,
Arthroplasty.
and proximal femoral prosthetic replacement, total hip arthroplasty, with or without autograft, or so patient pays. If you're on strictly Medicare, folks, this is Medicare A and B, nothing else going on, you would pay on average $2,140, or if the hospital, close to $2,000, $1,927. That
Right.
is interesting. That is interesting.
Isn't that a cool tool?
That is way cool. I have got to bookmark that. Medicare outpatient. You're seeing me bookmark this, folks, because it is absolutely critical to have. I'm going to put that as a quote engine because of that. That is a nice tool, and I can say Medicare is coming out with some phenomenal.
They're coming out with some. Yeah, they're coming out with some good stuff.
Yeah.
I mean, how many times do you know somebody, or you have a client that calls and says, "Oh, I've got to have this surgery. I don't know what I'm going to do. I don't know how much it's going to cost." You know, they're trying to budget for it if they're on original Medicare, and this is just, it's like, okay, that's what it is.
That's right. That's right. And what I was trying to say too, Leith, is people get surprised by the out-of-pocket expense, right?
Right.
That 20%, that $2,000 we just looked at. And so there's ways to circumvent that in an efficient manner.
Right.
And we're going to explore that as we go on here. We're going to explore how to take care of that and not be worried about having to pull out $2,000 along the way. And it's not going to be with a Medicare Advantage plan too. We're going to share some ideas and secrets as we go along. So that's kind of a little bit what we got going on here today. We talked about a piece of news. We talked about the Medicare.gov stuff. And the engine quoting thing, folks, is an aha thing for me. I think that is an excellent thing that Leith brought to the table here. So as we wrap it up, I wanted to share with everybody, speaking of the cost of care, I think this is an interesting thing I just want to share with everybody as we go along here, is the cost of care. We're talking the yellow box, everything about skilled care. That's the Medicare planning. There's your Part A and B, your Part D. We're going to try to go through this. We're going to go through in the weeks to come basics of Medigap plans, dental vision stuff. We'll cover that. Hospital gap. We just talked a little bit about that. We highlighted that, but we're going to go into details on that. But I also always like to tell people too, the other side of the coin is the custodial care. It's the care at home, care in a facility, care at the IRS is going to get a cut too. I'm going to talk about that. How in the world does the IRS get a cut of when I need to have care? And there's a little secret that the IRS is doing that. Short-term care options, and this is the custodial care options, long-term care, 55 to 65, different ideas now for 66 to 75, different things. So these are things to be looking at. One of the things that we're going to be doing as we go along here is, as I try to bring this up here, is let's see here if I can bring this back up here. One of the things that I'm looking forward to doing here is the live stream will turn on at 9, hopefully, if technology works. Today we had some Mac issues. Mac updated itself and threw me into a tizzy, so I'm working on a limited basis. But 9 o'clock, throw your questions in. We're over on YouTube and Facebook. And please, if anybody likes to do it, you can subscribe, like and subscribe. Tell your folks, friends and folks about it. Also, I'm all about Q&As too, so bring your Q&A. We'll try to address it on the following episode as well. But I also want to note, too, we're not doing it today, but we are also going to open up a Zoom. People like to be private. They've got private questions. So the following hour at 10 a.m. PST or 11 a.m. on Mountain Standard Time. You could be Central, but we will open up the Zoom room. And basically, you just come in. It's going to be a private session, one-on-one for just a few minutes or whatever. And we're going to give information on that as we go. Does that sound fun, Leith?
Yes, Yes. I think it's a great way because people really want, if they want some personal,
Right.
private conversation, it's a great way to do it.
That's right. That's what we're going to do. So we're gonna do that along the way. If you do want to reach out to Leith, there's a QR code at the top there. You see that there? That QR code? That's Leith's calendar, and you can scan that, and that would be a private one-on-one with Leith on a Zoom or a phone call. And that's the cool thing about that is if you got questions, and Leith can find out answers for you. I know it's going to be a hard thing as time goes on. I will say relationships are going to be everything. Relationships are going to be big moving forward because this healthcare system that we have ahead of us going to have professional navigation along the way, and I just share that with everybody there as we go. So. Anyway, Leith, there's our maiden voyage of a Monday.
Yeah, I just want to add to what you said about the personal relationships. Unfortunately, when you get the 1-800 numbers flashing across the bottom of your TV screen, that's a one and done deal. You're going to call, you're going to go through a phone tree. Maybe it works for some people. That's great if that's what they like to do. But if you want some, a long-term relationship with somebody that can walk you through the problems that you're having with your carrier or whatever, getting signed up, then, maybe that 1-800 number isn't the best option for you.
That's right. So and when people when people get on our email list too, we're going to communicate. We're building some systems behind the scenes here too to have an email communication go on as well. So more stuff is coming. So that's it for this maiden voyage, and we'll see everybody next Monday, 9 a.m. Bring your questions. We'll have some questions by then. Oh, we'll also have Medicare. Medicare will have disclosed everything October 1. Go to Medicare.gov and pull in some information. So with that, we're going to wrap it up, and you can give us a shout between now and then on the chat, or you can scan the QR code for Leith, and we'll see you next Monday.
Well, friends, we've reached the end of our 30-minute journey on Talking Turning 65. I hope today's conversation shed light on the challenges and opportunities you face as a rural retiree in the West. See how our Social Security income can be maximized. We know the struggles to create lifetime income. Seek to plan for tax-free income. Build Medicare planning that is affordable. And learn about long-term care planning that doesn't drain the savings accounts when a crisis happens. Have our wills and trusts current, so our family has our desires and not have the state make decisions. If you found value in today's show, please hit like, subscribe to our channel, and share this program with a neighbor or friend. Together, we'll keep the conversation honest and helpful for years to come. Thanks for tuning in, and we'll see you next time on Talking Turning 65.